I mean, I got your form. Doesn't look like you made any improvements. Let me.
Yeah, nothing like that I could point at and be like, yeah, yeah, nothing major. If anything, it's very minute, but
Okay,
nothing
so
big.
a couple things here that I do want to talk to you about. One of them is just to go over the stuff we went over last time. So last time we were like, hey, you're still getting exposed to milk. You're not really
Mhm.
doing paleo diet. Did you become strict with that, or what did you do?
Oh yeah, very strict.
Very strict.
Yeah,
Okay.
like not a single
No.
drop of milk, dairy, anything. Yeah,
And that made no difference for you?
perhaps marginally, but nothing major. But as I put in there, this is typically historically a really hard season for me. Just the transition to fall. You're getting these rapid temperature swings. So one day it could be like 27 degrees and it drop down to like 7 the next day. So yeah.
So since your last point, you eliminated everything.
Mm-hmm.
The other part of the we talked about last time was really keeping your blood sugar stable because
Yeah.
you were doing that no problem.
Yes.
Okay. So no symptoms, no shakiness, lightheaded, irritability. I mean, on the questionnaire form, you don't have any drops of blood sugar symptoms, which is like category 10.
Mm-hmm.
That's really good. Okay. Worsening some symptoms, night sweats, hair, scalp inflammation, pain. Okay. And then this is when you have your worsening of inflammatory symptoms.
Yes.
Okay. Now, your number one complaint initially was your vestibular autonomic dysfunction.
Yeah.
And then here you put your number one complaint is facial nerve pain.
Yeah, I mean, right now, that's my number one complaint. If I'm looking, I mean, the immediate right now, what's pissing me off, it's like, yeah, the nerve pain and inflammation, stiffness in the face. And I guess that's all due to it gets super dry here. It's autumn. It's like, yeah, everything just feels flary right now, if that makes sense.
Yeah. Okay. Let me just try to put it all together here. So do you think after like going through that autoimmune paleo diet and stabilizing your blood sugar that any component of this has an autoimmunity to it or not?
I think that it's helped marginally, especially with um, it's hard to say. It's hard to say because I would say that the last time I did it, I felt better, but it was again a really good time for me. It was, I mean, summer is always a lot easier on me symptom wise, just because the weather seems to be a little bit more consistent. And then as soon as you're getting into fall and winter and spring, it's just, yeah, it's not the best because we're constantly shifting seasons, if you will. So I do best when it's stabilized the weather because like I said before, that is the number one thing that I can count on that I know is a trigger, bar none. Doesn't matter. I could be traveling in the States and if it's consistent climate, I feel a lot better even though my diet may be not optimal.
Okay. What about your migraines? Have you had any difference in your migraine flare-ups?
No, I would say they're about the same.
Okay. So how often are you having them?
3, 4 times a week.
That's
Yeah.
terrible.
Yeah.
Okay. And last time we talked, you noticed that when you were going for walks, that could have been a trigger for you. Is that anything different or new on that? Because any motion or movement, especially going forward or back, cause any problems for you?
No. No, I notice it depends on the day, right? Some days I'm just more less resilient
Okay.
and some days yeah, so it's harder to be active, or I find it being active to be more triggering.
Okay. I mean, were you able to get your protein levels up?
Yeah, I mean, my protein levels are really up. I did notice, the one thing I will state that I kind of noticed pattern wise is eating tons of meat. I don't think that does well for my personal microbiome. It seems that that's not. I did notice more microbiome type of flares, if that makes sense. Gastric reflux, things like that I think has something to do with my heavy meat diet as it stands right now.
You don't have to do a heavy meat diet. You just
Okay, good. Because I'm trying to, I think I do the best on a very diverse, highly dense fiber diet. I think that works the best for me. with a lot of meat too, but like I definitely need to balance that out with a high fiber content.
We're just worried that you just may not get enough sufficient, you may not have sufficient protein. So if you're
Hmm.
100 pounds and you're not getting 100 grams of protein at least,
Yes,
one,
yeah,
you
totally.
like it's some,
I'm definitely getting 100 grams of protein.
you are
Maybe. Oh yeah,
now
for
you
sure.
are, but I'm just
Oh
saying,
yeah, for sure.
you go back to the diet you prefer, you can do whatever you works for you. Like, you can get like grass-fed beef protein powder and get 30 grams of protein.
Yeah, that's what I'm thinking. I seem to do better, especially I seem to be better if I could just have something liquid protein. I think that's why I did good with the kefir because that's something that's liquid and it does give you a good amount of protein when I'm drinking like 2 cups of it, right? Every that was one thing I was incorporating in that was giving me some protein. But again, the dairy is a concern. I
Uh,
don't know
yeah,
if that's a problem for me, but I'm going to just assume that it might be for now.
yeah, and it could take it some time to really clear up, you know. It's been about a what? Let's see here, last August, September, a couple months,
Yeah, yeah.
2 months. Okay, I mean, 2 months is pretty reasonable to see some change, but I'd still stay with what you're doing just to be safe
Yeah,
till we can see if we need some things to start to budge and change. As far as protein, like you don't need to eat 100 grams of pure animal protein and feel
it's hard.
you
I
don't.
love animals. Like, I
Just
love.
saying, you don't need to do that. We just try to get you were at 40 grams of protein when we did evaluation on your diet throughout the day.
Yep.
So if you can just get it up, and for people that do have a problem with difficulty getting protein levels up, I have been using the grass-fed beef protein, like get off Amazon.
Okay.
Um, and I think it's like 30 grams. Have you seen that one?
I've seen a couple like bone broth ones, and of course there's like the gelatin, but I don't know if that's a complete protein.
Um,
Um, but
let
it's
me
certainly something.
see it really quick for you. It's really good.
But I really like with the autoimmune paleo, something I will keep indefinitely, like something I want to try to incorporate later, maybe in a month or two, is egg yolks. Because I do think they're quite a nutrient dense food. And if I'm washing off all the whites, I think I shouldn't have a problem, but we'll see. And
Yeah,
then, of course, I might have an issue with dairy, but I don't know if I want to continue indefinitely cutting out butter and ghee and things that I think that
I
can
understand.
still, yeah, still have some nutrient value. And
Yeah.
then maybe one day introduce highly fermented dairy again and see what
Yeah,
changes.
just so you know, like we're not really attached to any philosophy. We just everything is diagnostic.
Hard.
Just trying to get kind of go through the layers just to make sure. I mean, we've seen your inflammation and you see high milk consumption. You're like,
Yeah,
that's right
no,
there. It's so
I
common, but it might not be your thing, you know?
I get the reasoning because when you look at the literature, it does seem to point in that direction,
Yeah.
or causing some sort of
This
inflammatory response.
this is the one that's great. I don't know if you have this.
Okay, I don't have that.
It's called it's from Equip. I've
Okay,
been using this patients, and you just mix it with water. And,
okay,
I've tried it too. It's pretty good. I like to put a little banana in there,
yeah,
frozen banana to make it thicker, and some ice and just water. And it's a nice way to.
yeah.
So
I
I think the serving size. Let's see here. So it's 21 gram of serving like per scoop. Easily
yeah,
2 scoops in there. You get 40 grams right there. That's which is your whole meat. It was just your whole, uh, protein intake before.
yeah. That would probably be helpful. I notice I must have really sluggish digestion. I just notice if I'm constantly eating, it doesn't work well for me. It feels
Yeah,
it's not the best for me. It seems to almost cause digestion issues and make me feel sick, burpy,
yeah.
bloated, all
You
those things. So I need longer periods of, I think.
have some dysautonomia issues for sure.
Is that it, you think? Yeah, that could be.
Yeah,
Yep.
so, yeah.
And
Um,
do you think that that's so the thing with the rosacea, I feel like that's the go-to diagnosis anytime somebody has inflammation of the skin. But I don't have any of the rosacea triggers. It's not like if I go into a hot bath, I get a flash, right? I don't get any of that. My face just looks sunburnt. My chest sometimes and my upper arms look sunburnt. It looks like burns. And if I go to the sun, that's a trigger. But um, Yeah, and it seems to come in hand when I'm having neurological issues or my scalp's again like scalp rosacea. I don't know. It seems like a poorly defined entity of just like inflammation, increased vascular.
Yeah, you
Um,
don't. That's how really what it is. You don't have to have like clear symptoms if you're in cold and hot changes.
yeah.
That's not for everyone. Okay, this is getting. Let's see if we're on the plan of attack here. So, have you been doing any of those vestibular exercises? Have they been making you worse, better when you do them? Any difference?
Nothing. I don't notice any difference,
You
to
don't
be
notice
quite
it.
honest. No.
How often do you?
A couple times a day, 10 minutes each, 2 to 3 times. So I don't really notice anything um, better or worse.
Okay. Sure. Okay. You had the ultrasound done. You said everything was fine there.
Well, so this is what I sent you. What was weird, again, you're showing there was lymph reactivity, right?
Well, I'm
But they were confused if that was just a baseline. And so we redid it. And when we redid it, showed nothing. So that shows that wasn't on my baseline. That was a reactive lymph inflammation, like the
okay.
lymph was reactive to something.
I'm sorry. I didn't see that. So let me look at that.
Yeah.
Okay. This is the one. So scalp folliculitis. Yeah.
So that assessment was done a year prior to me getting the ultrasound.
There's some thickness of your tissue. I look now. It's okay.
So my question is if I notice it happens when my symptoms are at their worst, which come in concert, and it's usually the week before my period. Um, I don't know why that would be happening. Like I just kind of put a lot of these other miscellaneous symptoms like night sweats and sore pain in my hands. I just thought it was like part of hormone shifts or something, like a perimenopause phenomenon.
Yeah. I
But
mean,
the lymph nodes, that does give me a little bit more pause to say, why is that happening?
right. Did you so we did the T and B lymphocyte panel back in
Yeah, there's no
June.
infection.
Yeah. I'm
No.
just
And you palpated the lymph nodes and you
yeah, I
you
felt
you
that.
felt the same thing.
Yeah.
So it's like and then I had the test right after. So if it was infection, you would think it would show up. At least that's what I would assume.
I'm trying to look through your file, but remind me, you did do a brain MRI, right?
I did a brain MRI in March 2021. Now my neurologist warned me that of course these don't see everything under the sun, but if it was,
March 2021. Okay. And it was just clear, right? No findings?
yeah, I wasn't getting the lymph node swelling at that time or the hair loss. That started after.
Let me look at your documents here. Yeah, when you're like having any change, nothing.
Yeah. Yeah, I wish this was easy. I wish it was like straightforward.
Do you
You
think
have
some of your the facial pain is from the surgery?
from the surgery, yeah.
No.
Yeah, and that's why so I have the nerve pain and stuff like that. And I think my neurologist just wanted to rule out any trigeminal um damage to the trunk of the trigeminal nerve, which it wasn't. It's just like it's basically like a phantom limb syndrome type of thing, except in the trigeminal.
Yeah, like you had this idiopathic anoscoria, just autonomic, you know.
And that was in 2013. So that was a long time ago. And I didn't have any neurological symptoms, like none. All the neurological symptoms started, I mean, directly after I took the drug. Like not a week later, not it was just directly after I took the drug, my reality changed. And then it was a progression of add-on symptoms, right? But there was never reverting back to my pre-state. Never ever happened.
This is for the infection you had when you were on a trip, right?
Yeah, and then the drugs I took, which was highly probable that they were counterfeit. Since 60% of all drugs in Peru are counterfeit,
And I
even when
remember,
they're sold.
yeah, okay. Just looking through your initial files again really quick, just to make sure I'm not missing anything, because we're coming with no hits here. No, no
I
change.
know. I know. I mean, yeah.
Well, for
I,
sure, I know you have convergent spasm. For sure, you have something wrong with your otolithic system. For sure,
yeah.
you have some injury, to your. I mean, you have some upregulated, you know, pain nociceptive pathways of your trigeminal system.
Mhm.
Um,
And the motor. So the motor facial nerve damage. My understanding is that any motor damage too, it's like you get that stiffness in the muscle and whatnot just from
yeah.
I don't know. It's that's a common phenomenon. My understanding of it.
Well, I'm sure you've looked it up and know everything about it.
It's actually no, it's a specialist that told me that. It's just like it's common when people have like Bell's palsy, right? And they don't fully recover. They get pain in the face, but the pain is not due to trigeminal pain. It's just due to basically the lack of it's like a cramping.
Right. Yeah, I'm not sure how accurate that is, but who knows? You feel pain. Where's the pain? Can you show me again?
The pain, so this is the right side, left side.
Yeah.
It's all here, but predominantly on the right side where the weakness is. Exactly the same distribution as the weakness, which the weakness hit
Right.
both sides, right? The right side was just worse. And it's it's I suppose it's forgivable, but also hard because this is all in the mid face, right? The injury, the site of injury is here. So the nerve branches were here. And where they branch off to is there.
Yeah, I mean
Because
that's
it's the buccal branch of the facial nerve, right? That innervates the
yeah,
depressor. The
yeah.
depressor is
VP2
removed.
range. Yeah. Okay.
So those, in my mind, those like that injury, the injury from the questionable drugs are kind of separate issues. Like I could have separate things going on in the sense like there's an injury to systems, but then there could be another process happening that's more immune dysregulation. And I don't know, I'm just trying to understand the other components, which is the swollen lymph nodes, the night sweats, which are pretty intense and happen again when the lymph nodes are activated. Um, and yeah, the hair loss and also the scalp inflammation with that hair loss and the pain, which is another like usually an immune thing going on. Like that's why the one clinician I saw, she thought perhaps it was scarring alopecia. She thought maybe what's it called? Folliculitis decalvans, which is a type of scarring alopecia. And that's why we did the biopsy.
Did you had any screening for malignancy?
Yeah. Because on the last ultrasound, they weren't activated. There was nothing shown. So then my doctor said, he called me and said, "Oh, great. Are you feeling better? There's nothing wrong." And I said, "Not so fast." Did you look back on the dermatologist report? Because why is she palpating that a year later? And I'm telling you, my first person testimony that this is happening on and on for the past few years. Like shortly after the hair loss, scalp symptoms started. This all started.
Yeah, and the thing is, I think sometimes trying to connect them all together can actually be more confusing and unrelated. And
Yeah,
sometimes
that's why you have to put them in different compartments. Like, and
you
it's good.
definitely had nerve injury. You definitely had some motor
Yes,
sensory loss. That's his thing. You
yes,
definitely have poor clear otolithic dysfunction, conversion spasm.
right.
Those are
But
not
those
benign.
were
Those are not
yeah,
normal. Those are totally pathological.
those were found though when I came home from Peru. 7 months after I came home from Peru, I was reviewed by a neurovestibular clinic. They saw those patterns of convergent spasms, which they didn't really take seriously at the time. And it wasn't until like almost a year later, all of a sudden they were trying to rush me into neuro-ophthalmology to get those checked out because, yeah.
Okay. Are you open for a full scan?
Yeah. Yeah.
Okay. Because I would tell you, like,
What are you thinking?
I just want to make sure, because if 2021 was when you had your last scan,
Mm-hmm.
um, sometimes you may have some neuroinflammatory demyelinating things that don't show up.
But
Um,
the only thing is the contrast dye they gave me, I forget what it's called. I did have a reaction to that.
it doesn't
So
have to do with the dye. You can do it non-contrast. Like you can do a full, what state are you in again?
I'm in Canada,
Oh,
but I can come to the States. Don't you worry.
okay. Because here, like, we can do a scan, full body scan, MR with an MRA to look at blood vessels, an MRI of a whole body. and even do a neuroquant for like 1,200 bucks.
Okay.
And then that would basically look at all your tissues, and it would, if there's any masses or any kind of underlying tumors, things like, because sometimes you can have like you can have it like, listen, don't freak out because the chance of
I'm not
this are
freak
low,
out.
but
No, no,
just
no.
don't we don't want to miss anything, okay?
Yeah,
Right.
yeah, totally, totally.
So first of all, you could have a chance of demyelination that just wasn't caught, and that demyelination doesn't, could be in your brainstem, doesn't could be in different areas of your spinal cord, could
Yeah.
be in brain, um, and you can have a lot of change between 2021 and 2023. Okay.
Yeah.
The other possibility just with is you could have a tumor which then causes autoantibody elevations. Sometimes
Mm-hmm.
people have a tumor, they just start to get antibodies to different tissue. Neurological tissue is a really common one.
Mm-hmm.
That with your cervical lymph node elevations, your white blood cells were nothing like that were a red flag, but
The
in
only thing that was the phospholipid antibodies that I had. That was the
yeah, I
only
remember you had that, but
antibodies that were
yeah,
activated.
you had that the Cyrix, but you didn't have like you didn't have platelets or any of the other autoimmune markers.
No.
Yeah, I remember here, Cyrix rate 5 exhibit elevated phospholipids, but nothing of associated with thrombocytopenia or platelets. Typical people that have autoimmunity, when they clean up your diet as much as you have and get their blood sugar stable, um, they have some change. You know,
Yeah. I think I would see more change if we moved. I think
but when you see like when they start seeing nothing respond, nothing move, nothing happen, very clean diet, very compliant patient, very investigative patient, look at everything.
yeah.
Then it's like, okay, well, let's rule out let's rule out some things you may just maybe missing playing this functional medicine game.
Yeah.
When are you gonna be back in the States?
We're just in the middle of a move right now, so we're moving next month. So it's going to be kind of hectic for the next few months, or the next month and a half. So I'm thinking December is reasonable to return back to the States.
Okay. There's actually okay, so there's two ways to look at this. So one of the things I would really like to do, and you tell me how you feel about it, is really rule out demyelination, any kind of like vascular issue, the MRI, MRA we can do together. Um, and we could also do the anti-malignancy liquid biopsy screen with the Gallery, those 50 tumors at once with a blood test.
Okay.
It's like, but that's like $1,000. So let's just say 1,250 for the imaging and $1,000 for the test is what it would cost you to like really screen that stuff out.
Yeah.
I don't know if that's worth it to you, or like if you don't want to go in that direction yet. It just that would cover like early tumors that are not really identifiable yet with imaging.
And they're using MRI, right? So it's not like, or is it X-ray? Is it like
There's no
CT?
radiation.
Okay, good. Yeah, then I
And,
don't
and
care.
yeah, and
I see no harm.
yeah, I do a full body MRI every 3 years, and I do a Gallery test myself every year.
Yeah.
So there's no,
Fine.
it's just like part of our
Screening.
screening, like because we're
Yeah.
not going to do any
Yeah.
physical that nonsense.
Yeah.
By
No, I
itself,
think,
you need more. So that
yeah.
would be okay. So I'm not saying that's the only thing we should do, but I'm just saying that's one thing we have to put on the list of diff die. Okay.
Now, something I was thinking about is more of an in-depth panel looking at antibodies. And one I was looking at was the AVISE panel for like SLE. I don't know if this would fall under like the symptoms of SLE, but it is something I was
Yeah.
thinking about just
Yeah.
because my rosacea is so atypical to
Yeah.
rosacea.
Yeah. You could definitely like check all the anti-nuclear, all the different SLE antibodies. We
Yeah.
could do it probably when you're in the States if you want, or you could do Canada. I know everything's difficult, but
They don't do the AVISE test in Canada, which is yeah, they don't have that here. So that might be something I need to do in the States.
okay, you can do that.
Canada sucks. That is.
Oh, I know. I've had so many patients from there, and it's like, oh my God, it's
It's
getting worse.
terrible. Oh yeah, yeah.
Okay. And the Avise test, what attracted you to that versus like other types of testing?
It's not perfect, but it seems like it covers all of the antibodies in one test. And I think
I
it
just
does.
I'm looking it up just to make sure I'm not missing anything. Oh yeah, it's just your anti-Smith, anti-SS.
Yeah, yeah.
Well, we can do that really inexpensively with LabCorp, no problem.
They're looking at different tests for SLE, which is like an interferon one marker or something like that. There's different yeah, it seems like the literature is pushing more towards that because it's not perfect. These diagnostic tests are not perfect.
The markers
And
look good here. If you want, I mean, we the testing we do pretty much test for almost all. Let's see. Let me just share my screen with you.
yeah, I know there's like a lupus anticoagulant, like things like that, because I did have those phospholipid antibodies that might be good to check out.
Okay. So
Yeah, that's the one.
so this is all part of a regular panel. CDC, that's not easy. That's not typical CD4 weight.
So the
But
other thing
this is
that
different. This is a patent marker Diet LabCorp doesn't have.
yeah, because to me the C3 and C4 being low on multiple blood markers now is kind of signaling to me, and maybe I'm wrong, but wouldn't that signify complement consumption, and wouldn't that kind of fall into the SLE camp or a possibility?
Yeah, for sure. Yeah, so basically all of these are pretty conventional except these two they have here.
Yeah,
Okay.
yeah,
I don't have an account with this lab, but I can certainly get one set up for you before you come out and order you the test.
that would be amazing. Yeah, that'd be really great.
Okay. Let me just make a note to have Susan, new project for her to get this. Okay. So Avi's test. Okay. So the thing is like you've been through so many random supplements, you've been through everything, you know all about nutritional supplements, you've done all the dietary things. We're just kind of concerned maybe you missed the blood sugar and not enough protein and milk, but we kind of went through everything that you've done. And maybe uh, some of the autonomic dysfunctions could be throwing off your gut and other things that are more neurological based. But it's definitely most important to find a mechanism that
Yes,
they continue into different protocols and different things, right? You agree?
I agree.
Okay.
Look how red I am. Like this is
Yeah.
it's not normal.
And then
And usually rosacea is just on the face. It's not on the chest.
and ultimately, like if it is autoimmune, I mean, you only have so many options. You can only clean your diet. You can look for chemicals. You can look for lifestyle sugars. You can look for some of those variables to some degree. But
There are biologics I can consider if that is
yeah,
the
yeah,
that is truly what's going on. But I would need like sufficient evidence rather than my own,
yeah.
half-baked hypothesis.
Nice.
Like, but there are, drugs I'm not completely against. I just think that they should be absolutely last resort, right?
No, I totally agree. I've had many patients, especially with neurological demyelinating diseases, that biologics have completely halted their progression, made a difference for them. I
Yeah.
mean, you just come with the risk of your immune system is suppressed, and you have susceptibility that.
Yeah, I don't. This is the thing. I don't know, but I think maybe having concrete understanding what's going on with some evidence behind it, it gives you kind of peace of mind. I don't have to then keep wondering what's going on.
Yeah. Is there any, one of the things you put in here, uh, on the document here was to organize a new strategy. Besides the advice test, is there anything else you thought would be good to do?
No, I think your idea for a full body like scan is really good.
Scan, scan, and then the liquid biopsy.
Yeah, I think that's good.
Are you familiar with the gallery test?
No, I'm gonna look it up though.
Like it's something like it's they did two large clinical trials. They've done really good outcomes, and it's really the future of preventive medicine. If you look at studies being done, and it's just DNA fragments, and they can kind of isolate the tissue. It's like it can
Mm,
come back and say something happened with the ovaries. These are the follow-up tests you need to do. You're seeing some DNA methylation at irregularities with these cells here, and then just the screens. So it'll just come back with like negative, and you pay $1,000, and you're like, okay, or it comes back and
yeah.
says check lung tissue, do the following testing. These need to be evaluated. And like for example, like lung can cause metastasis to brain, to other issues. and
Yeah.
to the cerebellum in particular. So can breast. Breast and lung are the two most common that spread into the otolithic vestibular system. If you don't have any, you did a self breast exam, everything's fine recently.
I do get swollen lymph nodes in my breasts.
Okay, well, let's get the imaging and
Let's get that imaging,
get
shall
that
we?
imaging. Let's get the testing done and make sure we don't have any other types of antibodies.
Yeah,
Yeah, some malignancy can. So if there's like an underlying tumor, it's all about early detection. You
yeah.
can early detection, and you can have those, and you can poly autoimmunity with any antibody showing up. Like a lot of times with Cyrix, everything's off the chart, polymorph reactivity, or sometimes people just have autoimmune symptoms. Sometimes the antibody made against the tumor also binds to cell tissue and causes ongoing symptoms there. So
And with autoimmunity, it is possible to have a negative ANA, right? And still have
for sure.
something going on.
Yeah.
It seems incredibly it's not common, but it doesn't seem out of the ballpark of possibilities
No, I
because
think
this
it's good. I'm actually interested about the advice test I had. There's two markers I've never used, so it's very great to learn
yeah,
about it through you.
yeah. So learning, it's just all learning. See, no, no, I think I'm totally in agreement. I think that that's a good idea to
It's
move
still
forward.
important for you to keep your blood sugar stable. As you know, it's still
Absolutely.
important for you to try to get to at least 100 grams of protein for body weight.
Yes. Do all of the things, but it's really hard when you're like damn near perfection in what you're doing and you're still not seeing that needle move. It's frustrating.
If we get the results back with those three and everything's still negative, we're gonna have to do like I'll just have to do a complete we go through a file again. And I mean, I know some of the diagnoses are correct, like the
Yeah.
vestibular diagnosis is 100% correct. Um,
Yes.
but that doesn't necessarily cause all these symptoms, and you may have just some permanent nerve injury from your surgical procedure. That's just going to
So
cause the facial pain.
yeah, well that's definitely what that is. Again, that happened right after. So we can draw conclusions very clearly there. Also, morphological changes in the face don't just naturally happen,
Skin
just randomly.
inflammation, the pain all over, the hair loss, this chronic lymph nodes, swollen lymph nodes in your breast. That's the stuff that does
Yeah,
not.
and pain in my hands, like stiffness, especially
Yeah.
yeah, randomly like before the week before my period especially and worse like in the morning. I'm not using my hands all night. Why are they like so painful? And there's no swollen joints.
Okay. Let's. So December we can get those tests done. Are you okay with
Okay.
that?
Yeah.
Okay.
Yeah, that should be fine. If anything changes, because again we're kind of in a crazy time right now where everything's up in the air.
Are you in California?
We are. So first we're going to buy an investment house here, but this is all happening kind of quickly. And then we're planning to buy a home in San Diego. So we have a house here and a
Oh,
house in San
nice.
Diego.
Fantastic. That'd be great. So the imaging place we have that we use that does a full body scans, it's about 45 minutes north from San Diego. It's like by Orange County. Just have
Okay.
really good clean screening, and they have a good price for those tests. And
Okay.
then the tumor tests is just they have a contract through Quest. So you just go to Quest, we'll give you some direction, the local closest one to you when you're back in California. And then I have to give you the test kit. The test kits have
Okay.
um, very short expiration dates. So we'll have to coordinate handing off the test kit to you while you're in San Diego,
Right.
or
Yes.
shipping it to you, or getting it to you somehow. And then you
Yes.
just walk into Quest with the test kit, and then we'll get the results. And the device test, we'll have to get an account and get that test kit ready for you and figure out how we either to get it from Bottomus to draw it for you, or they unless they have a contract they'll have to do, but we'll figure that out.
So, and I have one last question for you, and it's just in regards to the convergent spasms, convergent
Mhm.
nystagmus, which is so with the otoliths, my understanding is that so we did the vestibular evoked myonic potentials, which is basically like looking for anything peripheral in the periphery for damage. And they do that cervically and they also do that ocularly. And there was nothing found. And that was done twice. So that would kind of, my understanding is that would argue against it being from the otoliths.
No, that's going to be very specific for vestibular demyelination
Okay.
in the brainstem.
Right. So that's where
You could have central vestibular issues. You could have You could have a lesion in like your parietal and cerebrostibular cortex in the right parietal area, and
Yeah.
have otolithic symptoms just because it hits those fiber tracts that integrate there. It doesn't have to be.
Yeah, that's what my neurologist said. He said, no, I don't like that's it's central. I think it's central.
Yeah.
And he was more in line with that just because we have so much evidence of those other areas being tested and no, there's no problem there.
Yeah, those brain sector potentials are really good for looking at brainstem pathology. They're pretty good at looking at that, but again, you could have early stuff that didn't show up now. It can be moved.
Right.
Let's just do the imaging. Just make sure, like, let's not lose sleep.
Yeah.
Seeing a diagnosis.
It's good. You know what though? It's good to have a baseline because I would like to, like you, do that every 3 years.
Yeah,
So I
you
want a
should do it
baseline.
anyways. You should do it anyways. Get a baseline. Both those tests. Okay, so that's the plan then. So we'll go.
Okay.
Okay, good talking to you.
Awesome, Baptiste. Take care.
Thank you. Bye.